the Wake Up and Live with the Arts Show, the performing and cultural arts program which... Hello there and welcome to another edition of Wake Up and Live with the Arts. I'm Sue Johnson, your co-host, along with Gary Webster, our other co-host for this evening, and we are delighted to welcome you to Dr. Linda Gross. How are you, darling?
I'm good.
That's excellent. So what have you been up to? Haven't seen you since we did a play a while back.
Right. I'm actually probably going to audition for something next week.
Okay.
Although I have no idea how competitive it'll be. But
are you at liberty to say where you're going to audition?
I think not.
Okay. Well, give me a call off camera. Give me a call tomorrow, and if I can help talk you through and prep you through,
thank you.
through some of the audition procedure steps, let me know, and I'll be
That's
delighted
sweet.
to give you a few tips.
Thanks.
So, in addition to auditioning for a production coming up, you spend most of your time with your psychiatric practice. Is that so?
I do.
Tell us about your practice.
I have a private practice at the Green Road Medical Building, University Hospitals building. And
right down the street from where we are.
Exactly.
Mm-hmm.
And I see patients primarily for psychotherapy, and I prescribe meds when they need them. And I treat children and adults, and I also see couples.
I see. And what is there a primary topic or condition that you address, or are you just kind of a comprehensive, holistic type psychiatrist?
The latter.
Okay. What possessed you to become a psychiatrist and an actor all at the same time?
I was heavily into theater when I was a kid.
Mm-hmm.
I was in plays at Fairmont Center, and at school, and at Interlochen,
Okay.
what was then called Interlochen National Music Camp. I guess it's called something different now.
Okay, I wasn't aware. Mm-hmm.
And from musicals to Shakespeare to all kinds of plays, and then and through college actually. In college, I was in a Second City type comedy troupe.
Okay.
And then I was in a play after college, and then I went to medical school. And
was there a reason, something precipitated you switching over from your interest in the theater arts into medicine?
Good question. I'm not sure how much of it had to do with being practical and having my parents say, "You're going to do what?"
And that's exactly what happened to me too. Why I ended up
right?
as an English teacher. Yes.
Haven't we all heard that? Those
yes.
of us who want to pursue something in the arts, whatever it may be.
Right.
Yeah, right. Get a real job.
Uh-huh.
Exactly. And I'd always been interested in what makes people tick, and I found a report that I'd written when I was in 8th grade that said I wanted to be a therapist, which blew me out of the water.
Mm-hmm.
I don't remember being interested at that point. But it's sort of being a psychiatrist is sort of a natural for me because I'm just interested in understanding people, and I enjoy the process of seeing them change. And so it was between being a psychologist and being a psychiatrist. It wasn't between being a pediatrician and being a psychiatrist.
Mm-hmm.
Well, Linda was obviously one of the first multitaskers because actors need psychiatrists. Most of us should take advantage of the abilities of a psychiatrist, so you cut out the middleman and you can take care of yourself. You can
I don't know about
analyze
that.
yourself.
And I try not to act while I'm being a psychiatrist, but or vice versa. But there are certain things in common with the two. I mean, there are both of them involve understanding another human being and in a compassionate way, sort of understanding what makes them tick, trying to sort of get yourself into their skin in a certain way. Obviously, the ends are different. I mean, I'm not trying to, do therapy or treat my role on stage, but this sort of interest in people and understanding them and empathizing with them.
And I could almost see
similar.
how, as you develop your character, like you say, get
Exactly.
into the skin of your character, what makes this character tick?
Exactly.
Why is she or he behaving the way he or she is? What's their background? What are the factors that have come into play to help this person?
What are the motivations of this person? How, even if it's a character who is not the most likable character. There is, one's job as an actor is to try to sort of understand where they're coming from anyway.
Right.
And try to make them human, even if they're, evil in some way on stage.
And bring the belief about that character, good or bad or indifferent.
Yeah.
Okay. So now how long have you been practicing medicine?
I finished my residency. I went to Boston to do my residency, and finished it in 1990.
Okay.
So I've been doing this a long time. And then when I decided to move back to Cleveland 20 years later, I went back into training and became a child psychiatrist.
Mm-hmm.
So I've been doing that for less time. But I've been practicing since, I graduated medical school in '86.
Well, speaking of children and being a psychiatrist, do you ever do kind of artistic or acting kinds of therapy with students, or get involved with their creativity, imagination?
Absolutely.
Mm-hmm.
Sometimes we do role plays.
Okay, sure.
And they can be incredibly helpful. Like with a couple, if they get to a certain point and they're having a hard time getting beyond that, you can even ask them to get into some sort of pose that represents their feelings and how they experience the other person at the relationship's most difficult moments.
Mm-hmm. Mm-hmm.
And they're often very powerful when they're in 3 dimensions, both for both partners.
Yes.
So sometimes I do that. Not often, but sometimes I do that. And with children, I use art all the time.
Right. Okay.
It's very helpful, and have you ever heard of the squiggle game?
No, tell us. What have you heard of the squiggle game?
I have not heard of the squiggle game.
No.
Tell us about the squiggle game.
How does that work?
The squiggle game is something that was started by Winnicott, who's a famous British pediatrician and gave a lot to psychiatry. I think he was a pediatrician and psychiatrist, I think. Anyway, what he would do is he would make a squiggle on a paper, and then say to the child, make this into a picture and tell me a story about it.
Mm-hmm.
So it's a creative, they can turn it any way they want and use any colors they want, and they make something and tell a story. And with children, their dynamics are right out there. And then they enjoy being able to make a squiggle for you. They always make them really, really hard, mm-hmm. and say, now you make a picture and tell a story. And, as a therapist, I play this game with my nieces and nephews, and it's just fun. But with patients, I'm paying attention to what they're saying in their drawings, and my drawing is trying to take it one step further, and then we go back to their drawing, and, so kids love it, and it's often really helpful.
I would imagine so, because it allows them to express their innermost being.
Right.
When they get to that point of trust, or at least losing themselves in the
Exactly.
artwork. Yeah. Now, as a therapist who is also an actor, can anybody come to you for their services, or must they be referred by another physician?
Depends on their insurance or whether they can self-pay.
Well, if in that case, in case there are people, and actors certainly need you, your services. How can you be reached if somebody were interested in taking advantage of your services?
My telephone number is 216-297-2100.
Okay, would you repeat that for our audience, please?
216-297-2100. And if you forget, you can call the University Suburban Health Center, which is the name of the building on Green, and ask for my number, and they can give it to you as well.
Do you have regular office hours, certain days of the week? How does that work?
That is changing a bit.
Okay, so it's in flux, it's flexible
Yeah,
now.
it
So
is.
just give Dr. Linda. Oh, that sounds like a television show coming up. You have your own show, Dr. Linda, and acting. And with that, we're going to get ready and thank Linda for being on our show, our first guest for this evening.
I just want to ask one thing very quickly, because
Sure.
it's something that
Sure.
I always get mixed up. The psychiatrist is also an MD.
Correct.
Psychologists are not, psychiatrists are.
Correct.
Yes.
That's what I always get confused. I get confused about a lot of things, but that in particular.
And she can prescribe medicine, and she can give injections, so she can do, she's a medical doctor. Okay. And with that, my dear medical doctor person, thank you so much for coming on.
Thank
and we'll
you.
be rooting for you in your upcoming audition.
Thanks.
And hope to see you trotting the bull very soon. But take me up on my offer. I would love
Okay.
to chat with you.
Thanks.
To help get you ready.
It was a pleasure.
All right. Don't go away. Don't go away. We'll be right back with our next guest. And you stay tuned so you'll